Hi, so I'm going to be presenting on CPT and HCPCS coding or HCPCS coding. So to start, I'm just going to explain a little bit about the difference between HCPCS coding and CPT coding. So for CPT coding, it stands for Current Procedural Terminology. These are codes set by the AMA. They're used for billing, documenting, and communicating procedures using uniform terminology. These codes are used for intervention, so not to be confused with the ICD-10 coding, which are used for diagnoses. HCPCS coding, on the other hand, they're sets of CPT codes. They're mandatory codes for Medicare and Medicaid and other health insurance programs, and these just help ensure that insurance claims are reported and processed in the same way. So continuing on just a little bit further, distinguishing between CPT and HCPCS, there are two levels of HCPCS codes. Level 1 are identical to CPT codes, but they're just used for Medicare and Medicaid, and they're called HCPCS codes. Level 2 are codes that are more used for projects that are used in procedures such as DMEs, ambulance rides, etc. So HCPCS codes frequently require more detail and more thorough explanation for equipment and procedures performed. That's just due to the way that Medicare and Medicaid require it. CPT and HCPCS codes may require different modifiers. Sometimes they can be the same, but typically you can distinguish these modifiers. There are two characters at the end of the code with a hyphen, and if the modifier has a letter in it, then it's usually a HCPCS code, and if it's strictly numerical, it's a CPT modifier. So continuing on, going into the history of CPT, these codes are established by the AMA, as I already stated, and this is important. They're determined and updated frequently by the CPT editorial panel, and the APTA is included in this panel, so PTs do get a say in the codes. And in 2000, HIPAA mandated all healthcare professionals use CPT codes as a standard to bill and document procedures, so once again, just nationwide, establishing this common terminology. So understanding the coding, when a PT includes a code in a claim for a payment, a PT is claiming that he or she performed the service, but the existence of a code does not necessarily ensure reimbursement for payment for the procedure. So some payers may limit payments, some payers may consider certain codes bundled and may not cover all of the codes, so that's where education is really important. And then some pairs of codes may not be allowed or may require extensive explanation for their use in a situation. So once again, that's all just that education about documentation to your staff. So macroeconomic effect on PT at a national level. Under HIPAA, as I said, CPT coding is the national standard for healthcare professionals. So this is the widely accepted medical nomenclature, and it's used across the entire country for pretty much any medical profession that you can think of. So they are used under public and private insurance programs, and Medicare and Medicaid both use them. And this just, once again, was used to establish a uniform language throughout medical care professionals, and it's really increased efficiency and accuracy across the entire nation. So microeconomic effects, from here on out, I'm just going to focus on the way that these codes can affect an inpatient acute hospital setting, since that's my clinical setting. So these codes have played an effect on financial planning in acute inpatient settings. Some intervention codes may be reimbursed for a higher rate than with some insurances than other really similar codes. So it's just really important to educate your staff on these stipulations to make sure that proper codes are being utilized for interventions that are performed and to ensure that the hospital is being reimbursed correctly for these procedures. Another way that it can affect finances is that hospitals must invest in newer software and technology that allows the ability to easily document and code for accurate services performed. So a hospital has to pay for the staff to be trained. They have to pay for this updated equipment, and money and time is lost when PTs are spending time billing and coding in a not efficient software, and also when they are being trained in how to use the software. So all of this requires money and time. And then software also must be updated to a point where they can be updated with the newer codes at the national level when they're determined, so that PTs can be up to date with the codes that they're using and be able to accurately bill for the most recent procedures that they're doing. So at a macroeconomic level as well, how these codes can affect management decision-making in hospitals specifically. The hospital needs to ensure that there is somebody on their staff that's staying updated on changes in CPT codes at the national level, and then be able to relay these changes to the staff. The hospital also needs to make sure that there's a staff member that's regularly looking at documentation and coding to make sure that the staff is doing it right to avoid being accused of fraud or abuse at a higher level. So it's really important that a PT understands these things so that they don't actually risk their career for fraud and abuse, and they know that they're documenting correctly. So CPT codes can affect policy and procedure development in the hospital as well. Codes are used for claims processing. Once a PT documents using a CPT code, the code is followed through many different layers of customer service and administrative levels just to investigate the effectiveness and validity of the code as well as determine reimbursement. Codes are used for developing guidelines for medical care review, and physical therapists and other staff in the hospital, once again, have to be informed on these changes in coding in order to accurately document and bill. So in summary, it's just really important that PTs understand these changes in coding and are keeping up to date. There's a lot of things at a national level that coding has helped streamline and improved efficiency, but on a smaller level, incorrectly using codes can affect day-to-day lives of PTs. So it's just really important that everyone is aware of the changes at a national level and how to properly use these. Thank you.